Welcome to another episode of the Fleischzeit podcast. Today we've got a special setting. We are in Baden-Baden during the medical week, a week where there are many speeches on actually the biohacker scene of the medical area. And tomorrow we will have a few speeches on carnivore. That's why we are very happy to welcome Shawn Baker, Dr. Shawn Baker from the US. He's actually the most prominent US doctor in the carnivore realm in the US. Then we've got Dr. Rainer Klement. He is a researcher on nutrition and cancer, and he's a medical physicist. Right. And we've got Dr. Elke Lorenz here as a visitor. She's going to hold a speech on keto and carnivore tomorrow as well, and she's a cardiologist. So thank you for coming, the three of you. And this time I thought, why not asking the community which questions they've got. So I'm going to take turns and ask and just pass on the questions that you sent to me. So I would like to start, of course, with Elke. Elke, what are your colleagues saying to you if they hear that you are a cardiologist and you are saying, well, meat is good and keto is good?
Oh, it depends. It highly depends. My former colleagues from the clinic I used to work are kind of curious, but most of them, let's say, don't believe in nutritional medicine, especially for cardiometabolic diseases. Well, let's say not nutritional medicine, but keto, or at least the low carb approach for cardiometabolic diseases. What I see and what I see in the community of keto people, keto researchers, but also clinicians doing ketogenic diets as nutritional therapy. It's not a belief, but it's hard science that it works. So it really depends to whom I talk. But I don't have to convince my colleagues because I know there is hard science. We have a lot of data of hundreds, thousands of people who cured their diabetes on nutritional medicine, on low carb approach or ketogenic diet. So, yeah.
You're fine with that. That's great. And I think more and more cardiologists are getting on your, they're also your opinion, but often they don't dare to say it aloud in the public because they're scared that they're being bashed or that even their medical license is being taken away. And I mean, you are independent, but some are dependent on the on our medical system, and then they've got problems. Yeah. Okay, now then, Rainer, let's get to you. Somebody asked whether you think is it critical if you are becoming or if you want to prevent cancer? Is it critical if you still have CT diagnosis, or if you have a lot of flights where you also have a higher amount of
radiation.
Radiation, thank you.
Yeah, natural radiation in the altitude. Well, I think not. I think one CT in a year won't make any big difference. Of course, we have the principle which is called ALARA, as low as reasonably possible, concerning ionizing radiation occupation. But for example, a CT, it depends on which body parts get scanned. If you only do the head, you might receive a dose of 1 to 2 millisievert. This is the unit, sievert. And for example, overseas flight to New York might be a dose of 0.1 or 0.05 millisievert per year. Yeah, and me as working in the radiation oncology clinic, I'm allowed to receive a dose of 20 millisievert in a year. That's the limit, and I'm not aware of any data showing that workers in radiation oncology hospitals have a higher risk of cancer through their occupational exposure. So I think, yeah, and if you, for example, if you do a whole body scan in the CT, it might be worth about 10 millisieverts. So basically you can do 2 CTs in a year and still be below the threshold where cancer risk really starts to rise. Yeah. So I think there are many other factors that play a role in predisposing us to cancer. Of course, radiation might be a trigger, but if you have a good immune system and you have good DNA repair mechanisms, and this is also connected to our lifestyle, then you probably will be safe. Yeah? Because we have been evolved to deal with radiation damage, because we lived outside and there's always some radiation coming down to Earth. And also, if we lived in caves, there's some natural radiation inside of the stone, from radon, for example. And we've been exposed to radiation the whole evolutionary time frame.
Yeah, exactly. Probably the same with heavy metals, right? Because now to you, I didn't prepare you for this question.
Oh.
I've got a person asking me whether you have seen that people, if they want to detox from heavy metals, if you think they need helpers, therefore, like chelators, or do you say chelators in English?
Chelators is how it is.
Chelators.
Yeah.
Or do you think that the carnivore diet can solve this on its own, that there can be a detoxification going on by its own?
Well, you know, our body certainly is equipped with its own endogenous detoxification system. Just, you know, largely what our liver does. We have ways to excrete various things through sweat, through urine, things of that nature. So that's going to occur over time regardless. Now, can you facilitate that with some sort of chelator or some sort of binding agent potentially? Again, I don't know what this person's particular issue is and how they're demonstrating some sort of heavy metal accumulation. That may just be a theoretical risk. And so I don't know that this is not something that I particularly specialize in. I tend to be skeptical for a lot of these cleanses and things like that. I just think they're kind of mostly kind of nonsense-based, to be honest. I don't think, you know, taking some sort of, you know, like some people consume like bentonite clay or something like that as a thought that it might help to remove these things. I don't know that's going to provide any significant benefit. Probably isn't, you know, particularly that harmful. I think the same rules apply to most things. You know, do the appropriate lifestyle things and let your body deal with it as it would normally would. Like, get good sleep. Don't poison yourself with what you're eating. And I think a lot of the food supply effectively is kind of, you know, particularly maybe not so much in Germany, but certainly in the U.S., a lot of the food supply is just loaded with things we shouldn't be eating. And then I think regular exercise, good sleep, good diet. I don't know that you need to add much to that.
Yeah. I often say, well, actually, animal organisms detox by themselves, and plant organisms mostly want to accumulate toxins because it helps them to protect themselves from the environment, right? Yeah.
Perhaps a bit of another perspective on that. I'm totally with you. If we have a good lifestyle, kind of a natural lifestyle, we can probably deal with toxins, environmental stuff. But if we didn't have for years or decades, and we are kind of toxified because we ate the wrong food, we lived the wrong lifestyle. I think there is probably an indication for like chelators or some detoxifying therapy to help the body cleanse off, but then after that to implement really kind of a natural lifestyle that can deal with the lowest level of toxins we can have.
Yeah. So sometimes if you have too much of a load, then it can be good. Yeah. And what do you think about exogenic ketones? They are not natural, but do they help people who are not in ketosis? Do they help people on ketosis, or is it even for both a possible benefit? I mean, in my eyes, they often contain artificial sweeteners and flavors. What do you think about that? Yeah.
So, exogenous ketones is, kind of a new product, let's say. It's, in my opinion, it's not artificial because our body produces ketones if we fast, if we are on a ketogenic or carnivore diet. But to take them orally from outside, that's kind of new. The literature or studies go back to the 1950s, 60s with exogenous ketones. And I think there is a benefit for both you mentioned, for people who are already in ketosis and for people who are not. What's correct is that most exogenous ketones are not solely ketone supplements, but they are products containing other stuff. So you have to bind the BHB, beta-hydroxybutyrate, to kind of other stuff like minerals mostly, we call it ketone salts, or you have ketone esters. That's another product. So you always have to bind the BHB to some stuff, some other molecule. And exogenous ketones aren't good. They don't smell good. So you have to kind of flavor it. And they come along with sweeteners. Often it's erythritol, stevia, monk fruit, kind of that. So most of the exogenous ketones are products that contain other stuff as well. What the clinical experience shows us is that exogenous ketones can have a therapeutic indication with people who need kind of a very low GKI. So GKI is glucose ketone index. And there are therapies in oncology with cancer, but also in brain-derived diseases, neurodegenerative diseases, or epilepsy, where ketone levels have to be really high. And not all people, and we know that from the carnivore community, not all people reach high ketone levels, even on a carnivore ketogenic diet. And for people who are not in ketosis, let's say people who already have insulin resistance or type 2 diabetes or high blood pressure or altogether, exogenous ketones can also be beneficial because what we see is that they help us to transition into a better lifestyle. Exogenous ketones, for example, they have a lot of benefits. For example, they lower the hormone ghrelin. Ghrelin is our kind of hunger hormone. So they help to overcome cravings and to transition into a more low-carb ketogenic lifestyle. So I see both benefits on both sides.
Okay, thank you. That's very interesting. Eine kurze Werbung an dieser Stelle. Wer sich noch nicht mit der karnivoren Ernährung auskennt, aber alles Wichtige dazu erfahren möchte, der kann sich unser Buch bestellen, das Handbuch der karnivoren Ernährung, auf unserem Shop carnitarier.eu. Natürlich haben wir auch noch andere Produkte, nämlich so zum Beispiel ein schönes Cappy mit unserem Logo oder eine Edelstahlflasche mit unserem Logo, eine Grillschürze mit unserem Logo und natürlich verschiedene T-Shirts und Sweatshirts in weiß und in schwarz, auch Badehandtücher. Und das Tolle ist unser Spruch mit dem fettes Fleisch ist meine Medizin, karnivore Ernährung. Mit diesem Spruch werdet ihr viel Aufmerksamkeit bekommen und viele interessante Gespräche haben. Natürlich möchte ich auch die Produkte von Carnivoro empfehlen. Mit dem Code Carnitarier bekommt ihr 10% Rabatt bei eurem ersten Einkauf. Rainer, can glyosis in our brain be healed through carnivore? And also the question whether epilepsy can be healed by carnivore.
I think epilepsy definitely, because of course we don't know that directly from carnivore studies, but we know it from many ketogenic diet studies. And if we do a carnivore ketogenic diet, it is supposed to be therapeutic as well. So there's definitely an indication for a ketogenic diet in general, and I think a carnivore ketogenic diet could be maybe even more therapeutic because you get rid of all the plant toxins as well. Concerning glyosis, I think that's a very rare pathology in the brain. It's basically a scarring. You can compare it to a scar in the skin caused by proliferation of glia cells, which are the supporting cells for other neurons. And it's basically caused by some traumatic event or some neuroinflammation. And well, if we have to deal with trauma or neuroinflammation, we also know that a ketogenic diet might be beneficial because it reduces neuroinflammation. So I think there might as well be an indication for a carnivore ketogenic diet, but I'm not aware of any data showing benefits of a ketogenic or carnivore diet specifically for this pathology. So it's just from the mechanisms pathology that I would expect to see some benefits.
Okay. Yeah. Just as with other things probably too. Then now Shawn, we've got a question because you have such a huge community. You've got a lot more insight into carnivore diet and how it works and how it doesn't work than we have because you've got so many more cases in the US already. The question is whether ferritin levels can rise during carnivore if people are have really low ferritin levels, if they can rise quickly, and if this is at all always of an advantage.
Yeah, well, certainly I've seen people, actually I've seen it both ways. I've seen people with hemochromatosis, which is a genetic disorder where people tend to store abnormally large amounts of iron, and when they become metabolically improved, that their ferritin levels will actually come down. And the thought behind that is that ferritin or iron absorption is controlled through the gut through a hormone called hepcidin, which is in turn controlled by insulin. And so when insulin is sort of returned to a normal state where we don't have hyperinsulinemia, presumably, a lot of people have that, where we'll see abnormal absorption of iron. It's hard to clear iron. Males particularly, it's hard. Women with the menstrual cycle, you lose some of the iron. But men in particular tends to see it rise a little higher. And I've seen people with hemochromatosis that regularly have to give blood donations to keep their iron levels in check, actually normalize their ferritin levels in some of their iron stores. So that occurs. Conversely, people with very low iron levels, because now you're presumably consuming a lot more heme iron, which is more bioavailable than the non-heme iron that would you get from either supplements or a plant form. And so you might see a slight rise. I don't see it going into the levels that you would see where it's typically considered pathologic. Now, also we have to remember that ferritin is also considered an acute phase reactant for inflammation. And so if we have anything that's driving inflammation, whether it's exercise, a viral infection, a recent trauma, I would expect inflammatory markers to go up to include things like ferritin. And the question becomes then, what is the driving reason for the ferritin to increase? Is it because we're just consuming more? Is it because we have some sort of other underlying either chronic or acute inflammatory issue? And I think that the reasons are probably more important than the actual fact that it rises. And we talked about this at breakfast. Ferritin is one of those lab markers which has a fairly high coefficients of variance, and so that means when you measure it from time to time, there's a fairly wide, error rate basically. So you don't really know. So if it's a 10-20% difference, it's probably even within the margin of error for measurement. And then not to mention the fact that there is sort of day-to-day variability in there. So unless it's a really significant rise, like a doubling or tripling of a relatively high number, I don't get too excited about that. And it's the same for a lot of other labs. I think we have to realize that, one, we don't have baseline data on this specific population to say whether it's bad in this situation versus a general populace where we have, at least in the United States, we have a lot of sick people. We have a lot of inflamed people. Most people, the average A1C in the United States, hemoglobin A1C, is literally pre-diabetic at this point. That's the average person. And so that's a very different population than presumably a lean, healthy, otherwise, what you consider a healthy person on perhaps a carnivore diet. So I think the real answer is we don't know for sure, but I think there's ways to look at it where, this may or may not be a problem. And I wish we had definitive answers. Hopefully we'll be able to get research actually funded so we can do some of these things. But it's an interesting question. But I tend to go back to the holistic whole view of the person and see what's going on here. If it's a marker of inflammation, then you'd expect other inflammatory markers also to be elevated. And often we don't see that.
Yeah. And now, actually, I would like to just get on to that thing about the HbA1c that we talked about. There was a question whether it can, how long it takes that it gets lowered. And you said, okay, there are two aspects here.
Yeah. So hemoglobin A1c is traditionally considered a 3-month sort of time frame on what your blood glucose is. But blood glucose has been over those 3 months, and that's predicated on the fact that red cells are assumed to live approximately 90 days. Now, Verta Health, who has been doing low-carb ketogenic diets now they've got 5-year data on that. One of the things they mentioned early on was we're seeing the hemoglobin A1c values actually changing much more rapidly. Like sometimes within 2 weeks, you can do it twice and you can see it. Now, there may be variance between the measurements. There are also a lot of non-blood glucose related factors that could impact the hemoglobin A1c. One of which Elke and I were talking about at breakfast, is that the red cells may die prematurely. There's something that's chewing up your red cells, or you have a traumatic event or something along those lines. And so if the cells don't live very long, then the hemoglobin A1c is artificially low. Conversely, if the cells are living longer, and you would assume a healthier person, the red cells might live longer, then you may see an artificial elevation of the hemoglobin A1c. So it's not as good of a measurement as we think it is. There's a lot of variance in there. So when somebody says, oh, my hemoglobin went from 5.2 to 5.4, I really don't get too concerned about that. I think it's questionable if that's even a different number. So we have to be, again, we live in an age where we have lots of measurements. We can measure literally thousands of things. And it can be very anxiety provoking for a lot of people because it's just like, one, we may not know the answer. Two, it may depend on the reason for it. It may depend on the person themselves. So like I said, I don't get too hung up with numbers unless there's specific pathology that seems to clinically correlate with that. I get a lot of people that will send me their lab values, just cold. Can you look at my labs? I don't know anything about you. So any interpretation I might have has to be tempered by that. So, but yeah, I mean, for those people that wear CGMs, you'll often see a significant discordance between what my A1C is and what my GMI, my average glucose has been. And so some of that may be these non-blood glucose variables. It may be differences in how accurate the CGMs are versus the A1C, or how accurate the A1C is. So there's a lot of things in there that we don't necessarily know.
I'm at the moment wearing the Freestyle Libre 3 from Abbott, and I've got the feeling that it's always like 20 points above that what I measure with in the blood. And you just told me, Elke, that you've got a one from CBO, and you have got the feeling it's more reliant, or how do you say reliant? Yeah.
Accurate.
Accurate. Does it also calculate the GMI for you? Do you know that?
It
Yes.
does.
Okay.
It does. Yeah.
Yeah.
Perhaps one thought on HbA1c, which could be valuable, is for women who transition into menopause.
Yeah. Yeah.
Their HbA1c can increase, but only because they are not bleeding
Yes.
anymore, and their half-life of erythrocytes, the red blood cells, is longer.
Yeah.
So we have to keep in mind in which phase of life or which environmental environment we live in, which can influence HbA1c.
Yeah, the other thing is there's other ways to, you can look at things like a fructosamine, which is another test, which is a kind of an alternate test to sort of predict how long how much glucose is in the blood. Also things like you can kind of assess how old the cells are in the blood, looking at something like a reticulocyte count.
Fructosamine.
Fructosamine is an alternate measurement of consider. There's not as much validated data on that, but it does give you if you're really concerned, if you're like, I every time I check my blood, it's, my glucose is under 100, and yet you come back with a 5.8 A1C, that doesn't make sense to you. It may be the red cell. It's hard to measure red cell life in a regular lab test. That's typically a very expensive sort of research-directed tool, or they have to tag the cells, and so it becomes challenging to do. So there's other proxies, fructosamine, reticulocyte count, which are the baby red cells. And if we have a lot of baby red cells, that means a lot of the other ones have died early, and so we have a disproportionate amount of those. Okay. That would indicate you have your cells aren't living very long. If you have a very low reticulocyte count, then you could presume that your cells might be living a little bit longer. It's not an exact science, but it gives you some estimates.
Okay, interesting. As always, very, very complex, everything. Yeah, well, then I'll get to Rainer now. Otherwise, Rainer is right. What do you say about carnivore and dementia? I mean, we will have a speech tomorrow on carnivore and dementia, and I'm going to try to interview the referent afterwards. But have you already noticed positive effects or heard about that in your clinic studies? Or
no, because we mostly deal with cancer patients, not with dementia patients. But again, from the studies that I'm aware of, dementia can be at least slowed down significantly by ketogenic approaches. For example, there are studies only giving MCT oil, and patients see improvements from the ketone bodies. Because there is, in the research field, some researchers are convinced that dementia is nothing else than an insulin resistance in the brain. Some even call it diabetes type 3. So again, I would, from the pathomechanisms that are at play, I would expect that a carnivore diet will be beneficial in at least slowing down the cognitive decline.
Let me just add on there, because one, I would maybe direct that person. There's a guy named Matt Phillips who's a neurologist. He practices in New Zealand. He's done quite a bit of work with neurodegenerative diseases, including dementia, and he's seen significant improvement. In the United States, there's actually a fellow by the name of Hal Cramner who runs several nursing homes in Phoenix, Arizona, and he puts his demented patients on a carnivore diet, exercise, and some other things they expose them to, and he's seen significant improvements, some to the point where the patients were able to return home to independent living. And so anecdotally, clearly we're seeing improvements in dementia. So it's worth at least experimenting. I don't think there's a real downside to doing that. This is another maybe use case for exogenous ketones, because again, sometimes demented patients, it's hard to get them to follow a particular diet. But certainly the potential is there. I think there's some early research that would be supportive of that, particularly in the ketogenic space. And as you know, carnivore diets have a lot of similar properties with ketogenic diets, depending on how they're implemented.
Yeah, yeah. Okay, yeah, thank you. And what was the other thing I want? Yeah, because of antibodies, I already asked you. Do you? Somebody asked me whether if on a carnivore diet, if their antibodies on a certain kind of food will still lower, although they are still eating this kind of food. Like, for example, if they have antibodies against milk, and did you experience that sometimes, although they ate it, the antibodies got lower and they had a better tolerance?
Yeah, I don't think that's been measured. I mean, we mentioned before, I mean, with autoantibodies, like things for Hashimoto's disease, we do see that. In fact, there was a study in China that came out earlier this year or end of last year, specifically looking at autoantibodies, thyroglobulin and TPO, thyroid peroxidase. They came down significantly on people on low-carb diets in general, and they also saw a decreased swelling in the thyroid based on MRI studies. But as far as do we measure antibody responses to somebody that says has a milk allergy or something like that, or a milk sensitivity, I don't think that's been done, and certainly has been done in the context of a carnivore diet. Now, do we see people where they have an intolerance to something suddenly be able to do that? I have seen that a number of times, and strikingly, one of the most really shocking to me is I've seen people with anaphylactic reaction to things like shellfish, where they get deathly ill, their throat closes up, they go carnivore, and then I don't know why they do it, but for some reason they try to eat shellfish again, which seems like really like, I don't know why you would do that. I've seen anecdotally where several people now said I couldn't tolerate shellfish, now I can. I've seen that with dairy, I've seen that with eggs. And so I do think there's something that maybe fixes our immune system so it functions more correctly. So I think that's happening. But to say we have studies and we've measured those levels, that's not been done to my knowledge.
Yeah, yeah. We experienced exactly the same with our nephew, or my nephew, Nick, whom I had an episode quite in the beginning too once. He had the same with shellfish, and it is gone now. He can eat shellfish, yeah. Elke, sorry.
Yeah. In my opinion, there's the big connection is with the gut healing. So leaky gut, inflammatory bowel diseases lead to a lot of food allergies or food intolerances. And I mean, the carnivore diet is the kind of the most nutritional elimination diet that can really, really help healing the gut and heal leaky gut. And so for me, it's not, it's quite understandable that some allergies or intolerances, can just decrease. Absolutely.
Yeah, yeah, right.
And that we don't see antibodies, IgE or IgG, against them anymore.
Yeah. It really is amazing. And another question, especially to you, from Lederhosen War. That's the name. A combination of, Lederhosen and then war. Well, with a Lederhosen, you won't win a war. Okay, sorry. It's about LDL. If somebody has a high LDL value and he has already had an ultrasound which found out that there are no plaques in his arteries, do you still say he should do a heart CT?
It depends, but we know from a lot of studies that we don't have a good correlation between atherosclerosis of the cervical vessels and the coronary arteries. So in fact, there is no correlation.
Okay.
So it may be you don't have any plaque here and you have coronary heart disease. It may be you have kind of a plaque here and you have a CAC score of 0.
Okay.
So there is no correlation. So I don't decide having a CAC score, which means coronary artery CT, by the fact that I have plaques or I don't have plaques, but from the whole perspective of the whole cardiovascular profile. So risk factors, and not only traditional risk factors, but modern risk factors. Family history is very, very important. And also other genetic issues, like especially lipoprotein little a. and by age. So if I have a person with high risk factors in their 40s, I would highly recommend doing a CAC score, because we know a CAC score of 0 is the best predictor of not having atherosclerosis, not getting atherosclerosis, and not getting cardiovascular events.
Yeah. I heard from other cardiologists who are carnivore friendly as well, that a good other indicator is making an ultrasound down here in the...
Yes.
How is it called?
Femoral.
Iliac.
No, it's inguinal.
Inguinal,
arteries.
okay.
Yeah, that's what I always preach.
Okay.
Because atherosclerosis begins earlier here than there.
Okay. Okay. Yeah. Yeah. Really very interesting. Okay. Rainer, your thoughts about being in ketosis continuously or over a longer period?
It depends on the individual. Yeah? I mean, you feel very good on a chronic ketogenic diet, me not. Yeah. Because I run into problems with exercise, and so I use ketogenic diet strategically, maybe 1 week, maybe up to 4 weeks, with more like basic endurance training, for example. But then I recognize that my body craves for some carbohydrates, and immediately I feel better. So I think it's highly individual. Of course, you can, if you come from a high carbohydrate diet and you may be some kind of insulin resistant, you can benefit from transitioning to ketosis and then staying in ketosis for a longer period, that the body has the chance to heal. And afterwards, if you get more and more insulin sensitive again, you can use ketogenic diet strategically, I think. Yeah, you don't have to be in chronic ketosis to achieve the maximum health benefit. Yeah. That's my experience also with clients. Some clients simply don't feel as well when they do a ketogenic diet chronically. Yeah, it highly depends. I would always ask myself, am I feeling good with the way I eat or not?
Yeah, yeah. Yeah, I agree. Well, me with my children, my son has the same problem, that he doesn't feel good in a constant ketosis. Or also with the line diet, right? You needed to add eggs, and also my daughter did it during puberty, the ketogenic diet, very, very strictly. She did PKD. It was actually very good for her health, but her stress levels went up and she didn't feel well. And probably insulin was just too low, and she was still in a growing state. And it was, we actually had a strong backlash then, and now she's trying to get closer to stricter carnivore again to get her allergies.
Also, if you're pregnant or breastfeeding, I think you should be careful. Yeah. It's not to say that a ketogenic diet is per se dangerous in those periods of time, but I think you do better if you add some carbs.
Probably because of the insulin, having more of an anabolic state. And that's another question that I've got to you, Shawn. It seems to be, I'm very curious because I know this person who asked me the question. I'm curious whether there is something going on in his life. At least he was asking whether a woman during pregnancy, whether it is okay if they have cravings for sweets, whether they should really follow the cravings or not.
Yeah. So I mean, I think usually, and I think back to the previous question here, I think part of it is you have to consume enough. I mean, and one of the things, there was the ISSN, the International Society for Sports Medicine, put out a statement on low carb versus standard carbohydrate diets, and said that depending on what situation you're in, low carb diets or ketogenic diets are either neutral or they're slightly detrimental. But the main variable was that confounded that was inadequate protein and inadequate calories. And so I think some of the things can be overcome with consuming enough protein and enough calories. I perform very well on a very, almost completely carb devoid diet, but I eat a decent amount of protein, 200, 300, 400 grams of protein a day. And again, I'm 120 kilograms. So I think I can overcome some of those concerns. But as far as, a pregnant woman, why is she on the diet in the first place? Is she dealing with some sort of epilepsy or cancers? Probably not. And so is there any reason for her to remain strict carnivore? Probably not either. And so I unless there's a reason that would preclude her from trying that, either make sure she's consuming enough, because, obviously you've got a growing fetus, your caloric requirements are going to go up. Same thing with during breastfeeding, you've got to eat more. And if it's challenging to consume enough via carnivore, because it can be very satiating. That's one of the benefits for a lot of people when it comes to weight loss. It's very satiating, but it can be a two-edged sword in the fact that we run into the problem of under-eating. And so carbohydrates are easier to consume. They just are. I mean, they are, they're obviously, for a lot of people, they taste very good. They are, easy to consume, easy to acquire. So I don't see a problem with that. I'm not a religious person about this particular diet. I think it's a very good therapeutic option for a lot of people. And whether somebody wants to do it for, 6 months or 60 years, I'm agnostic to that. I think it's fine for probably most people. But again, I think, if there's a real reason for a craving, and it might be tied to hormonal fluctuations, like, as we mentioned, ghrelin is one that drives appetite. That usually has a diurnal pattern to it. It could be just she's just not consuming enough calories, and that might be something to consider. But if that's not the case, then adding something in, I don't think it's going to be directly harmful. Now, again, whole food, carbohydrate-based food, obviously better than ultra-processed garbage, which so many of us overconsume.
But is the diet still ketogenic if you go up with the protein to, let's say, 2 grams per kilogram?
No, it's not. It's probably not ketogenic at that point. But it still can be
starts to
carnivore. It can still be carnivore, right?
Yeah.
Sure.
Well, this really it's extremely interesting, this Exogenous diet, which is on just raw meat and raw products.
Bonder planets.
Bonder planets,
Yeah,
right.
Right, yeah.
What do you think about that? Is it such a benefit to eat foods raw or meat raw?
Yeah, I mean that's a question. I get a lot of people that think I'm an idiot because I cook my meat, and I don't think there's a real problem necessarily eating raw meat in itself. The problem you run into, and I've seen this happen to many people, is they have problems with contamination, and even people that have been very seasoned, they sometimes run into this issue, and it can be a problem that can persist for years. I've known some people that have had that problem. Now, I've had raw meat from time to time. It's quite common. I'm sure I don't know if in Germany where you can get things. Obviously, sushi is raw meat. Essentially, you've got what we would call beef carpaccio or steak tartare. I'm not sure what the German equivalent of that would be, but yeah, that's fine. I don't see a problem with that. One thing I found, and I tried to do a raw meat diet for, I think it went 3 weeks, and I did not enjoy it. It was just something I couldn't sustain. And one rule that I found is no one will stick to a diet if they don't enjoy the food or if they're hungry all the time. So you've got to be able to enjoy it. We have been cooking meat, arguably. I mean, even the consensus among anthropologists is at least 250,000 years. And there's probably more and more evidence that goes back even perhaps as far as 1.5 million years to coincide with when Homo erectus left Africa into Ice Age Europe. And to survive, they had to have, they were able to harness fire. That's the only way they could have survived. And if they were able to harness fire, they probably cooked. And so we've been cooking meat for many thousands, if not millions of years. I think we're well adapted to it. I don't think there's a problem with it. Like I said, I have seen people, like it's interesting because I've seen people that have had ileostomies, that have had their colon removed for various reasons, either Crohn's disease or trauma or cancer or something like that. And then what they'll tell me is if the meat is very well seared and charred, that some of that charred meat does not get absorbed, right? So there could be an argument for that. And I think the happy medium for that is, if you consume a steak, sear it on the outside real quick and you can eat it rare on the inside. And I think you're going to get almost any theoretical benefits from eating raw meat by doing it that way. You can avoid some of the potential concerns around contamination because it is a real risk and it does occur. And I know people that have been significantly harmed for that. And I am not convinced that people get superpowers from eating their meat raw. I mean, it makes good for a nice Instagram post or kind of draws more attention your way, but I can't see any significant it's so much better for somebody. And I just don't see it that way. So I'm not saying people shouldn't do that. I think it should be cautious about that. But I don't think it is like, 20 times better than eating a cooked steak. I just don't think that's realistically what's happening.
Yeah, that's the same what the clinic Palimedicina in Hungary says. They also say you can eat everything cooked. It's fine as well. Yeah. Whereas I love it raw, but recently I must admit I've got this dry-aged meat, the outside of the dry-aged meat made to minced meat. And recently, I think it was in the after I opened it, it was in the fridge for 2 days or so, really. Also, and then I ate it. I just snacked a little bit, and I felt at once cravings to. I had to go to the loo, and just it came out. So somehow my body knew that exactly. And at other times, I love this dry-aged meat. Yeah, thank God, my body tells me. Yeah. Okay. Now there was another question. I think it was to you, right? It was to you, Rainer, whether you know any contraindications to carnivore.
Yes, probably because I wrote about that in my book.
Okay.
Yeah, I mentioned a very rare syndrome called the anti-alpha-gal syndrome, which is basically a kind of allergic reaction to red meat.
Yes.
So some people, if they eat red meat, they get probably 3 to 6 hours later, they get allergic reactions like urticaria, which is in German it's called Quaddel, like some skin issue. They might get some pruritus or itching issues, or they might even get an anaphylactic shock. Yeah. But it's this type of reaction is transmitted via ticks. Mm-hmm. So in Germany we have these Zecken, Holzbock. And it first appeared in the 70s, as far as I know. So could be some new evolutionary feature, but I think it's probably some artificial, artificially caused allergy. Mm-hmm. And luckily, it's in Germany at least. It's very, very rare. So. This, to my knowledge, this would be the only real medical contraindication to try a carnivore diet.
Mm-hmm. I'm in a contact with one of these persons, and she was actually asking me whether we have experiences that this diet that this allergy can get less.
Of course, yeah. We don't have any data on people actually trying red meat in the context of a carnivore diet who have this syndrome. Yeah. Maybe there's a chance that by eating, maybe they start with a carnivore diet with less red meat and then slowly transition towards more and more red meat. And in this way, simply by leaving away all the plant toxins, the immune system calms down and the allergy resolves. That's, in my opinion, that's possible, but it has never been shown or tested.
Mm-hmm. I'm not sure.
Maybe you know some anecdotes.
I think I recall a case study where that was the case. And I mean, we're back on gut situation, autoimmunity, and cross-reaction with tick-borne disease and immune system. So I think if we are on a healing journey, and as you mentioned, I can begin the carnivore diet with kind of fish or poultry, something like that, and try to transition over time. But I think it needs time. But I recall a case study where that was the case. Yeah.
Okay.
Yeah.
Mm-hmm. Yeah, I mean, with regard to these ticks, I mean, classically, this alpha-gal syndrome is classically in the U.S. Considered to come from something called a Lone Star tick. Although the reality is there's several ticks that actually carry this problem, so it can be more than just that. If you're bitten by the tick, some people develop an allergy, many people won't. Some people develop an allergy that's very mild, it doesn't really impair them, but a small percentage of people will develop a very severe allergy. Fortunately for most people, it ends up being temporary. It's something that often will resolve on its own over a period of months to years. I've seen people will do carnivore in that situation where they will avoid, and it's a problem with mammalian meat, so any kind of mammal meat. So you would have, of course, pig and cow and lamb, and of course they would eat chicken. They'll eat things like duck or even some of the larger birds like ostrich or emu or something along those lines to sort of make up for that. So that's something. But I think the natural course for most people is it actually resolves over time, but it may take quite a while, and you might have to slowly, as Elke had mentioned, just kind of gradually add in and go from there.
Okay, yeah, very interesting. Good. Then now, two last questions to Shawn. I think one of these things most of the people already know, whether you eat organs, yes or no. Maybe you have changed in the meanwhile.
I don't eat them routinely. I've had them occasionally. If somebody has them for me, I'll eat them just to be a nice guest. But I don't regularly include them in my diet. I don't find any benefit in the times that I have done that. In my experience, and this is just based on observation, I did a specific survey to 12,000 people on a carnivore diet asking about organ meats, and about 15% actually ate them on a recurring, regular basis. The rest had some lower version. Many people didn't eat them, and there were no difference in the outcomes, at least what I had seen. When Harvard did their study that David Ludwig published out in 2021 on 2,069 people on the carnivore diet, I specifically asked Belinda Leonard's, the primary researcher, please ask this question because I want to know, because I don't know. And again, they found the same thing that I did. It didn't seem to provide any unique benefit whether you ate it or not. Now, again, I get there are people that will say they have anecdotally will have a benefit from consuming that, and I don't discount that. And it might be that some people that are particularly deficient in whatever, vitamin A or vitamin C or something like that, might see a transient benefit from doing that. So I don't discourage people from trying it. Is it absolutely necessary for everybody to do it? I would say absolutely not. And that's, again, my sort of philosophy, if you will, around this diet comes from people that were doing it long before I was, and they'd already collected a data set that they've been doing it for 10, 20, 30 years, and they could say what was actually required and what wasn't. And they would say, look, the organ meats are certainly not required, and you can eat them if you enjoy them. A lot of people don't enjoy them. When I look back at our historical, evolutionary past, I think we existed in a time of not subsistence but surplus for most of our time, and I think it makes sense if we look at how we went from a very small 300 cc brain to a large, 1,300, 1,500 cc brain, depending on our time frame. That would not have occurred in a time of subsistence. And so I think when we look at these indigenous populations that eat, quote unquote, nose to tail, the reason they do that is because that's all the food they have. And so they have to make sure they have, adequate food. But when you can go back to the time of the Native Americans, when they did their buffalo drops, they would kill, 200 buffalo and they would only harvest a handful of them. I think when we were consuming large megafaunal animals like the mastodons and the mammoths that roamed across the Eurasian steppe, the great example would be people in Central Europe called the Gravettians. They were specialized mammoth hunters, and so they could literally eat mammoth whenever they wanted because they weren't hard to kill. They weren't hard to track. I mean, it's physically hard to kill, but it's not a difficult task they couldn't do very frequently. There's a great paper called Elephant Hunting in the Pleistocene, and it describes it. It said man could kill elephants whenever they wanted to, and that's what we probably did through most of our early existence until they ran out about 80,000 years ago. And so when you're eating in a time of full subsistence, most people eat things they enjoy. I mean, I would do it. I still do it today. When I get a bunch of meat, I'm going to eat the ribeyes first, and the last thing I'm going to eat is something I don't particularly enjoy. And I think, for me anyway, I don't find the taste of offal very, very appetizing. I think most people have, and that's why it was, it's called as offal, and it was often discarded.
Therefore, from the name. Okay.
Yeah. So I think it's one of those things where yes, they're nutrient dense. Yes, they can provide benefits, and for some people they certainly do. But to make the blanket claim that everybody needs to do that to be successful is just not consistent with what we actually see in practice, or at least what I've seen clinically in practice. So I tell people if you enjoy them, go for it. If you get a benefit, great. But if you don't, and you don't feel like it, it's probably not a big deal.
I think what our ancestors always preferred was the fat.
Fat, sure. Yeah.
Animal fat. Yeah.
And I
That's
mean,
the most important part.
the liver. Well, I love liver. Some people love liver, and I think if you like
Liver
it,
is
you should eat it.
liver is very lean. No, it's a very lean,
Yes,
lean
yes.
source, high in iron, high in protein. And again, as Reiner pointed out, fat was something that we had to have. And I think, like people that say, well, look at a lion, they'll go after the viscera first. Well, because they're hunting lean animals, the viscera is the only place you're going to get fat. And they don't really have access to the marrow cavity. They don't have access to the skull. It's just they can't do that. So the only fat they're going to get is what's contained in the viscera, and that's probably why they go for it, because they realize that. And lions have a lower requirement for fat than humans do. Humans went after brain, we went after bone marrow, we killed the fattiest animals we could find because, again, we are fat primates. If we compare ourselves to any other primate, we're the most fat, and it's directly because we require so much fat.
Cats can eat up to 70% protein in their diet, and they have a much better capacity for gluconeogenesis than we have.
And they don't get into such a ketosis like we do. Yeah. And I often think that, as far as I can look back, I always saw people hunting with dogs as helpers. And if the dogs need a lot of food, we know my dog eats a kilogram of meat a day, meat and bones. And probably the people gave the dogs a lot of the offals and the lean meats as well, and they took the fattier meats for themselves.
Well, if you look at like the interview that Stefansson did, Vilmar Stefansson in the 1950s, 1960s, he was interviewed in his late 70s, and he specifically said that, look, we largely did not eat organs. We gave them, except the kidneys occasionally, we would generally give them to the dogs for that exact same reason. It just wasn't something that they felt they had to consume outside of unusual occasions, so it wasn't really a regular part of the diet.
Right.
How much fat do you consume in order to grow more?
In order to grow, I'm done growing.
In order to gain weight?
Well, I think that, again, my diet is probably around 70% fat calorically, right? That's typical. That's ribeye steak, at least a ribeye in the United States, where we have nice grain fat and beef and all that stuff, where we can get more fat in there. I think it's more of just a volume amount. I think that I can tell you anecdotally, for me to be weight neutral, I have to consume about 3 pounds of meat a day. That keeps me kind of neutral.
1.5 kilograms.
Yeah, 1.5 kilos. Again, I'm 120 kilos. I'm a big person. If I want to lose, I will consume less. If I want to gain, I just have to consume more. So I might be eating, something like 2 kilos a day or something like that, and I'll gain a little bit of weight. And so it's the fat and the protein come together. I think for that purpose.
Yeah. And 70% of calories from fat means about 70% fat percentage in the meat. That's why ribeye has about that.
Yeah, I think if you do the math, it's about 1 gram of protein and 1.5 grams of fat. I think that's about a ratio. When you get to 2 to 1, it's about 81%, and then like 1 to 1 is like 62%.
Do you use additional fat, for example, for frying in a pan?
Well, it depends on what I'm cooking. Like if I'm cooking like eggs, I'll throw butter or ghee in there or something like that, or maybe if I have some bacon fat, I might use that. But I usually cook a lot of things in the grill, so it doesn't require the fat for that. Yeah.
Thank you 3 guys for taking part in this interview. I'm very thankful. You have helped our community a lot with answering our questions. I would like to recommend, first of all, Shawn Baker's book in German. It's called Die Fleischfresser-Diät.
I didn't pick that name. So.
Who did that translation?
Translator, actually, because in Germany a Fresser is actually only an animal, and a human is an Esser. So they should have written Fleischesser, but they wrote Fleischfresser, so as if we were all animals. But no, the book is cool. I've got it, and it has a lot of information also round about everything about the carnivore diet. Then I can recommend Reiner's book. It's called Krebs, Weckruf des Körpers. About cancer, what are the causes of cancer, and how can you also prevent cancer. And Reiner also publishes all his studies on his webpage. I'll also link that into the show notes. It's called www.reinerklement.com. Yeah, and then I would like to recommend Elke's web page. It's called www.ketobyheart.com. Elke is also doing, if you don't want to get completely deep into carnivore, you can do fat fasting courses with Elke, which means actually eating a very, very high percentage of fat to lose weight and get metabolically healthy. Maybe that is a good approach for you. And otherwise, Elke also does nutritional advice. And as we already heard, she is cardiologist and keto expert. So She can help you for sure if you've got any problems with the ketogenic diet or maybe also cardiovascular problems. And of course, I don't want to say nothing about my book. It's called The Handbook of the Carnivore Diet. You can also buy that on our shop, www.carnitarier.eu. Right. Okay, then. Thank you all and see you next time.